Hello everyone, my name is Candice and I'm going to talk to you about the effectiveness of Cognitive Behavioural Therapy, otherwise known as CBT, in the treatment of Generalised Anxiety Disorder, otherwise known as GAD. The key points that will be covered in this presentation include the following. What is GAD? CBT and its relevance in mental health nursing, search strategies used to retrieve the information, levels of available evidence, the quality of the evidence, reported outcomes, and lessons learnt from the literature review. So what is GAD? GAD is defined by the Diagnostic and Statistical Manual of Mental Health Disorders, DSM-5, as excessive anxiety and worry occurring for a period of at least 6 months about a number of events or activities. Individuals often find it difficult to manage their anxiety. For the diagnosis of GAD to be made, the individuals must display at least 3 of the 6 symptoms listed in the slide. GAD clients typically worry about everyday things such as work responsibilities, finances, personal health, worldly events, and household tasks. GAD clients will often ruminate on these worries and often go around in circles. GAD and anxiety disorders are considered to be the most common mental health disorders in Australia. In 2007, the Australian Bureau of Statistics put out a survey known as the Australian National Survey of Mental Health and Wellbeing. The survey was a national epidemiological survey aimed at identifying the prevalence of mental health disorders in Australia. The data found that 45.5% of Australian adults suffer from a mental health disorder at some time during their lives. The data indicated that anxiety disorders are the most common mental health disorders experienced among Australian adults, and that in any month, 739,000 Australian adults report symptoms meeting diagnostic criteria for anxiety disorders. This slide displays a graph based on the data from the survey. It indicates the percentage of anxiety disorders experienced by Australian adults during their lifetime through to the last 30 days. CBT and its relevance in mental health nursing. With high prevalence rate of GAD, this means an increased number of patients seeking treatment for anxiety disorders. It also means health clinicians have to ensure that the treatment we deliver is evidence-based and the most effective treatment available. And CBT is one of the many clinical interventions that mental health clinicians may choose to use in the treatment of GAD, as this is evident by the literature presented in this presentation. CBT is highly effective in the treatment and the remission of GAD symptoms. CBT encourages patients to challenge their negative thought patterns in order to change their behaviour. So what are the search strategies? I began my search by using EBSCOhost as it collates the relevant databases that contained all the articles I needed. I used Sonal Health Source, Nursing Academic Edition, Medline, Psych Articles, Psychology and Behavioural Science Collection, and PsycInfo. I then chose my keywords, which were CBT and GAD, to find the relevant articles. As you can see, the databases here display a lot of articles, so I narrowed my search by adjusting my parameters. I used full text and date ranges to narrow my search to the most relevant articles. Once my parameters were set, the number of articles reduced, and I was able to find the 3 articles I would find most useful for my literature review. So what is the level of available evidence? In order to appropriately arrange my 3 articles in its relevant levels of evidence, I used the National Health and Medical Research Council level of evidence, which is displayed in this slide. The National Health and Medical Research Council provides a research hierarchy to assess the quality of evidence. The first study I chose was a meta-analysis. The study performed a meta-analysis review of other studies, including a controlled and within-group random effect sizes, making it a level 1 study as they completed a meta-analysis on literature which were considered to be level 2 studies. My second and third studies were randomized control trials, RCTs, Both the studies use computer-generated allocation of the participants, thus making these studies both level 2 studies. So the quality of evidence. The first study is a meta-analysis and classes a level 1 systematic review, as meta-analysis is a form of systematic review. This indicates that the quality of the evidence is considered to be evidence-based. Also, a meta-analysis has limited opportunities to influence the outcome, thus the likelihood of biasness is low. The study is also current, making more relevant and up-to-date. The size of the sample was ample, and the study used appropriate databases to conduct the searches. The second study is an RCT and is classed as a level 2 based on the fact that it is an RCT, where the participants were randomly allocated into groups by using computer-generated allocation, and thus this would reduce the likelihood of bias. The study lacks some consistencies, as one therapist was used to treat 61 out of the 65 participants, thus possibly creating some bias. The clinical impact is substantial, as the interventions used in the study can be replicated and applied in Australian healthcare settings. The third study is also an RCT and is classed as a level 2, also based on it being an RCT and the participants were randomly allocated into groups. The study also used computer-generated allocation of the participants, thus reducing the likelihood of bias. So, substantial clinical impact, particularly in the way CBT can be delivered over the internet. The study is also applicable to the Australian healthcare setting. So what are the reported outcomes? All 3 studies reported overall effectiveness of CBT as an intervention in the treatment of GAD. Study 1 found greater improvement in the quality of life of those suffering from GAD, and that face-to-face CBT more effective than internet-delivered CBT. Study 2 found overall CBT to be more effective than applied relaxation therapy in the treatment of GAD. CBT also had a higher overall remission percentage. Study 3 found that overall guided internet-based CBT proves to be more effective than self-directed. The study found a higher remission percentage in guided than self-directed, but by only marginally. So lessons learned from the review of the literature. I learned that the 3 studies presented and demonstrated the effectiveness of CBT in the treatment of GAD. CBT has proven to be an effective internet-based therapy, thus increasing the accessibility and availability of the treatment for individuals suffering from GAD symptoms. CBT also has long-term remission rates of GAD symptoms, and CBT can greatly improve the quality of life of the individual suffering from GAD symptoms. So that's my presentation, and thank you for listening.